All right, folks, we are joined once again by Gloucester's Mayor, Sefatia Romeo Theken. How are you, Madam Mayor?
You know what? I'm doing as wonderful as everyone else.
And we're also here with Karin Carroll. She's the Public Health Director for the City of Gloucester. How are you, Karin?
Good, thank you, Corey.
So I guess right off the top, can...
I hate all three of you. None of you are showing your white.
What are you talking about?
Oh, yeah.
I'm a redhead. I figure I'm just going to go like white overnight.
I don't want to hear it.
You really do.
So, can each of you just sort of give us a briefing on the latest information that we should know? I know that's a pretty broad question, but just the latest update that you can give us.
Mayor, you want to start, or do you want me to give my sort of
you know
routine?
what, give the same, you know what, we have, first of all, I want to thank you all. This is very important because the fact is we'd like to get information out there. And I think too that instead of reading it, they actually see it and feel the emotion with us. It hasn't been easy. It has not been easy, and it's scary, like everyone else says. And you know, the aggravation of have to stay home and do go out and you know, oh my, they don't have a mask on, and they don't have a covering, and they don't have this and that. We all need to actually breathe. Protect yourself. If you have a mask and you have your gloves and you're walking into a store and someone else doesn't, you know, say you should have a mask. I got in the finger, I've gotten everything else when I said you really should have a mask, but I'm protecting myself. As soon as I go home, wash, 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 wash. The happy birthday twice. Protect yourself. Unfortunately, some people don't believe it, or they think we're nuts and they're going to do what they're going to do. Sometimes, you know what I say, you cannot, you know, ignorance is one thing when you don't know, and I think we're trying to let everyone know, but being ignorant is just being ignorant. You can't make it. So I tell everyone that's out there, you know what, breathe, do what you need to do, and continue, because you know what, I'm not going to say we're out of it, but the peak is just about to happen. And our director, Karin Carroll, is doing a great job with her staff. We're doing more than anyone else has done in the community. They actually follow of what we started. And I want everyone to understand this. This just didn't happen overnight and we're going, okay, let's all rush through this. This, Karin and her team have been working on it way before. In January, she gave me a little bit. And then in February, she says, we really need to think seriously about this or what we have to do, because it's coming. And we started our network. Now, people, this network that we have here is extreme network. We always have a network in the winter. I will bother Karin. Karin, get everyone together. We're going to have a storm for 3 days. Karin, we're going to have a heat wave. Karin, what are we going to do? We need to do this, get the social working, get the open door, get the action shelter, get all this, get that. We already have this network since I've been mayor. I don't know previously, but I know since I've been mayor. I love it. It's never happened for more than 3 days. Even cater bus, we'll pick them up if it's too cold. We'll do this and we'll do that. Now we were ready because Karin said, you know what? It's not going to be just a day, 2 days, or 3 days. We have to look at the long term and then take it as it goes every 2 weeks period. So I'm going to leave it up now to Karin to explain some of the things that they have done, where we are. So people are going to see National Guard. Oh my God, are we all infected? No. You know what? We like to plan ahead. And I was talking to Lieutenant Governor. She says, ask for the National Guard. And when I was telling my staff, they're going, oh my God, the mayor's overreacting. She's over-exaggerating. We don't need the National Guard. We're fine. I'm putting in it for now because I know we're going to need it. And they're saying, I said, look, I did that during the 215 blizzard. Believe me, we're going to get it and we'll need it. And when we do, it's just this, you know what? We are ready. And Karin wants to make sure that we get the best of the best for everyone. And I want to thank also the school department side, the nurses, they've been great. So Karin, can you let them know how you doing this, how they have the call? I mean, we got all the niches out, and you know what? I thought I was gonna, I thought she was gonna quit on me the first week because I was driving her crazy, crazy. She says, you know, she's shutting her phone off for a day. Don't even call me. That doesn't happen. It doesn't happen here. But she had a great team. Dr. Segal stepped in and stuff. I drove them crazy. You know, I was sure Carol, McMahon, I drove everyone crazy. You know what? But that's my job. My job is to stay on top of things and to make sure and to learn things, because you know what? I'm not a nurse. And for all of the healthcare workers that are out there, I pray every day, and all the essential workers, you know what? I want to thank you, because you know what? It's exhausting. And you know what? It gets kind of depressing too, because when you're really out there and you want your PPE equipment, you want everything else, and you think that nobody appreciates it, and then you hear people getting unemployment. Why am I working when I can make more if I stay home? Because that's the kind of people you are. You are caregivers, and you're amazing people. And even though we don't say thank you every single day, I do pray for you every day. So first of all, to everyone that's out there, the first responders, the healthcare workers, the essential workers, we couldn't be this little island the way it is without you. So thank you. Hi, Karen.
Okay, thanks, Mayor. I agree, and it's not bothering us. The mayor and I started a call early on in the piece at 7:30 every morning, and it's not at all bothering. In fact, it's been great because the mayor has her eye on other parts of the city that public health might not know, and she can help facilitate some ideas, connections, and anticipate what problems might be coming up in the community before they happen. So it has been a really good team effort from very early on. And that has made us be able to react nimbly and quickly to anything that comes our way. And in terms of things like the National Guard, yeah, we put our hand up. There was an opportunity that came up this weekend for the National Guard to come out to any nursing homes that requested their assistance, and they would test all of their employees, all of their workers. So when we hear about programs like that, we're connecting those folks with the managers at the nursing homes immediately and saying, how can we help? This is a great resource. Same thing with our shelter residents. We've had an opportunity to test all of them, or will be in the next day or two, and those workers. So as opportunities arise, we are ready to say, yes, we will take the assistance, and we'll make sure that we, are as prepared as we can be. And also working really closely with the other communities. I mean, the mayor is on with other governors throughout the state a couple of times a week or once a week. I don't know. It seems like
Not other governors, other mayors. I only need one.
the other mayor. Oh, right. You're not the governor yet. You're my governor. Okay, so the mayors.
Yes.
But yeah, and a lot of work ideas are being shared amongst communities, which I think also Gloucester has a long history of doing that, where we're not here to be the superstars. We're here to try to protect people and to share what we've learned. And if we have something that's worked well here, we're sharing it with our colleagues in other communities, and they're doing the same with us. So that's very helpful as well. And in terms of the schools, the mayor mentioned the school nurses have stepped up. We have probably 15 or more nurses at the moment who are working with us every day. They have a Zoom call in the morning at 8:45. They look at the new cases that have come in through the Maven, the state's database, and they look at how involved the case will be. They divvy up the work and they get started. And then if they have problems, they reach back out, or if they need things, they let us know. But they have been tremendous, and they're now working 7 days a week, covering every day. And we've been more than able to keep up with our cases.
And I have to say thank you to Karen, because when she says, Mayor, I know nothing's happened in Gloucester yet, but I need more money. I want to, and I says, okay, what kind of money? She says, well, you know what? This is going to be an outbreak, and we will not be able to get nurses, and we will not be able to pay them, and we won't find them. So I'd like to hire 2 now before the outbreak. So she was already hired 2 before we even knew what was going to happen. So we can at least have a little bit of extra help. So, I'm telling you, great director that we have here, hard work. And the fact is, we're looking like, we always look the disaster part. And if it's not, then that's great. But if it is, we're ready. And so our peak is supposed to happen. But, we're lucky. We're lucky we have all these nurses. Some people can't even get them. I listen to the mayors, I just got off the conference call with them. We twice a week, and one's on Sunday, and we have all these other conferences. We just left with the lieutenant governor, and she had to go do that press conference. But it's hard. It's really hard. All the mayors and town managers, that's even more difficult when you're a town manager. It's really difficult. And I'm telling you right now, Gloucester, I'm proud of you. I'm proud of everyone, because the network, and we couldn't sustain ourselves if it wasn't for Action Shelter or Action Inc., you want to call it, and the Open Door and that staff and everyone, the Gloucester Housing Authority, senior care. It's this networking that is just like boom, boom, boom. I can't do this. Boom. Karen, what can I do? Because when we call every morning, what should we do? And then we have our like 41 to 50 people on a call on Tuesdays morning. She updates us, and then if someone's missing something, it's just amazing. And So Karen, so if I was tested positive, I went to the hospital and they test, what happens then?
Okay, what happens then? The lab will have to report that through to the state. So your doctor, whoever ordered the test, should also give you a call, tell you you're positive
I'm not
or
testing
negative.
positive people.
Right,
I'm here at work. That's
not
just
you.
an example.
The
That'll go out.
hypothetical
They'll get
case.
just the pot. The mayor, that's positive.
No, that's right. Just a hypothetical case. So whoever ordered the test would be informed the results like any other medical test. And there, that provider would contact their patient and give them some basic instructions about what to do and what not to do. Given this is an outbreak that we're trying to control, the state has this other layer of a lot more intensive contacting and figuring out who their contacts are. So as soon as the alert comes through the database, which is called Maven from the state, and all labs have to be reported to the state lab in order to be confirmed. So as soon as they are, which now happens very quickly, we get an alert, we get an email, we go into the database, and we assign those cases to one of the nurses working that day.
The database, you said you have to be trained on that, don't you? Because I can't go on.
That's correct. That's correct. It's that's right, Mary. It's a tool that is it has patient information, so it's restricted access, and you need to be trained on how to use it. Yep. So a number of our school staff have been trained on that. They will go in, they'll read their case, they'll find out what's going on. If that person is in the hospital who's confirmed positive, they will reach out now to the hospital. We have a system set up with staff over at all of the area hospitals, and they will communicate with us around the patient, who their contacts are, and who else needs to be contacted by the nurse. If the patient's at home, we will call them and go over isolation requirements for them and what it means to truly be isolated. So their own bath, their own, preferably their own bedroom, their own kitchen facilities, or someone bringing food into them when they need meals with a mask on. So it's pretty serious to be in complete isolation, and that's what we really want until you've been cleared, all those symptoms are gone, or a sufficient amount of time has passed. And so the nurses check in daily with the confirmed case. They make sure you have food and connect you to resources if you need them, mental health resources, food, toilet paper, garbage bags, whatever medical stuff, whatever the patient needs to safely isolate in their home. And then any close contacts of that case will also be contacted. And that's what we call contact tracing. And that's where the nurses will call up everyone that's been in close contact with the confirmed case up to 48 hours prior to their symptoms starting. So they really have to backtrack sometimes about who they were with. And then we start the process of contacting all those people and asking them to stay in quarantine, which means they can leave their room, but they shouldn't be leaving their house. They shouldn't be coming into contact with other people. And these are the kind of extreme public health measures that are going to help us contain this outbreak and have helped us. So it's working well. We've had really good compliance with most folks in town. When they get contacted, they understand the seriousness and they're very cooperative. The nurse team is great. You know, sometimes they're acting like counselors to these people. They're helping them access food and whatever else they need. But sometimes it's the only contact someone's having all day is with our nurse team. So they're really patient and spend a lot of time with them if they need that.
We also now are setting up, for, the housing authority, and for our seniors, we're doing well care checks. We're doing, having a list now compiled so we can just call our seniors, say, hey, how are you doing? Some don't talk to people. We say we go crazy. We know all the technology, but can you imagine just sitting there all day long and just having your TV and that's it? So we're working on that. We understand that our senior center was used as more of a therapy place for people to come and associate with other people. And we know that now they're home alone. So we're working on that. We set up a lot of these programs and we did it slowly, and people didn't realize that before the governor even said the 25 days, Karen and myself already went around and told everyone, you can't have anything done. So we set that up. And then they went from the 10 people per facility to none and stay at home. And people are wondering why the extreme measures now with the playgrounds and why are you doing all this now with the masks? Is because we tried what we're doing. What's happening? How many patients do we have? Where's the peak? What's going on? So now that it's the extreme peak, it's the most dangerous time is these 2 weeks. And we realize that some people were not social distancing. we had to actually do a little bit more to make sure that, you know what, some people say, well, I'm too young. It doesn't have an age, except, you know, usually toddlers don't, but it doesn't have an age. And you don't know who's carrying, and we don't know what's going on and how long it's going to last. We have all of these things that it's in the air, it's in the plastic, it can go in your shoes. Well, you know what? We're going to try to have everyone stay home. Please don't go to the playgrounds. Please don't go to the places we have closed. If you need to take a walk, of course we do. If and I felt good, I went grocery shopping for other people because I just wanted to talk to people myself. The social distancing, how do you do it? How you not do it? And we closed down we made sure that, you know, most of the beaches were closed anyways, as far as the parking lots. We closed down Stage 4 Park because we realized, and I went, it's not like, okay, you're hearing things always on the computer. When I hear them, I go, oh, I got to go check it out. And I took rides, and I actually asked people, I'm sorry, honey, you know, that's the most dirtiest thing right there is that slide, that thing that child should be on because all the germs in there. Well, I was told where to go, and the mother took it offensively, like, I don't think, what, you don't think I washed my child? You know what? It's not that. It's just that then your child just ran up to that person's child who's going to run up to that person. And you know what? I says, it's a time that now we're going to have to yellow tape some of the stuff, and we're going to have to zip tie the basketball hoops and do that. And I feel bad because the dog park's there, and a lot of people say, well, I can't have access. We left the visiting center. There's a lot of the beaches that are, you know, now all the streets are full, and people say, why are you doing this to Dogtown? We're taking this serious. We're going to ticket. You know, you're not supposed to be parking. We're warning people, you know, wear something, whether it's a scarf, I have my mask, whether it's a paper one. You know, a lot of people saying it's difficult because they can't breathe when they have a mask. Either can I. You know what? And the point is, put the scarf, whatever you feel comfortable with. And I told some people who are very high risk, we will go shopping for you if we have to. If you cannot wear a mask, and there's a lot of people who are pregnant, they're ready to have their babies, and I'm going, is the insurance going to pay for if they have it at home? Can we do the demoulas, whatever they call the doulas or boulas, whatever they call? They're going to kill me because I don't know the names of it, the hubba-doulas or whatever they are. It's all I know is, will the insurance cover it? And I'm very, you know, I asked all the questions, and some of the insurances says, no, we won't. We have to go to the hospital. And so I went, you know what? Oh, unless it's an emergency that, you know, it happened at home, but no, you can't plan on having it at home. And we're looking at all those, everything. I asked the insurance company, you know, it was my favorite thing is insurance. We asked all of those questions just to make sure that every kind of condition we might have in Gloucester will know, and things that we don't pop up today. Tomorrow is recreational boating is supposed to open up. And I was like, we can't have all these people because every other community, they closed theirs. Newport, Rhode Island closed theirs, Rhode Island, everywhere. And we're still open because ours belongs to the state, and the state hasn't closed that. So I approached, I did a conference call with the Harbor Master's office and Jim Destino, because some of our landings do not belong to us. You know, Dunfudgeon, there's the state, and the state says, oh no, it's all open. And I was really worried because I said, you know, I don't mind you going out on a boat. You know what, enjoy yourself, go out on a boat. But social distance as you can, because you will, but how many are you going to put on your boat? And how do I know it's all family members? And I can't risk, you know, something happening that risking the Coast Guard because you were careless, or risking my Harbor Master's office because you were careless, or coming back to shore and bringing it all here, and you want to walk around or whatever. Rockport's closed. I laughed. They're calling because some of their boaters want to unload here. I can't go to Basket Net, take a walk, but you want to unload your boat here. I don't think so. No. You stay where you are. I got angry. I says, you know what? I have to protect people even out in the ocean. Our commercial boats are out there. Absolutely. Lobstermen, clammers, take your boats. That's essential. Non-essential right now. I'm trying to figure out something with the governor. We're working to figure out what we can do. We need to be the same thing all around. I can't stop private docks, but I want to make sure that we're all the whole state. And one thing they forgot was the coastal. You know, we're thinking about land, and now we're all coastal. So that came up today, and we're working on it. We're working. I'm sure you see already boats out there, and there were some people, as we were talking with the Harbor Master, he's going, I'm looking at a boat on this, and then he can't stop them. You can't, because right now there's no law in effect. Hopefully we'll get something soon.
Well,
Could you return to the nursing home situation, because that has been such a heartbreak, and just talk about what's happening in the nursing homes now, and also maybe expand upon the National Guard's role in that. Beyond testing, is there more than testing there?
Yeah, you want me to? I'll take that one for now. Yeah, the nursing homes, you said it, are really, really high risk populations. We knew they would be from day one. It's a lot of our high risk population living in one area, it's confined space, the staff coming in and out. So should there be an asymptomatic exposure there, they're moving throughout that building all day, exposing those very high risk vulnerable patients. So, as we've seen throughout the country, that has been the spot where it's been devastating. So it's something that we were worried about from day one. As the mayor mentioned, we set up a task force of 30 or 40 members now from throughout the community. And our managers from our 2 area nursing homes were present early days at our meetings when we were still meeting in person. So that was a while ago. And they were great. I mean, we felt it was really important to have them at the table, to have them have a voice. And when we need to prioritize equipment, we have an inventory manager who works for the city. He works for our EMS department, but he works mostly he works first for the people collectively. So when he prioritizes who gets what, he's not just looking at city employees or first responders, but he's looking at everywhere. He's talking to the hospitals. He's talking to urgent care. He's talking to the doctor's offices and thinking about the needs of the entire community. And again, that's where Gloucester is unique, I think. Well, I don't know. I've never been a health director.
Today? He called Ocean Lot today to get some material and some elastic so they can make those. The firemen's wives are making all of these masks. So they ran out of elastic. So we called Ocean Lot. And he said, can I have some? So that was great. I mean, way beyond. Everyone's doing a little bit extra.
Way beyond. Yep, for sure. For sure.
Isolation factor with the people with family members in nursing homes. There's been this isolation factor that their family members can't see them at all. And I had understood there was the state had set up a phone number that people called. Could you talk about that?
Sure, and I can send that to you after, but the state has recently set up a hotline for family and public if they have concerns or questions about what's going on in a nursing home. And we get a lot of those calls through the mayor's office and through my office too. We definitely have a lot of concerns that have been raised or questions or people wondering how family are doing, what they can do if they need help. So this hotline is great. I haven't accessed it myself, so I don't know. I have referred a few people to it. So we'll hear from the state how that's going. But I think it was a really important step that they did this weekend. They've really formalized that statewide, as well as the National Guard testing. So it wasn't just a few pilot spots or a suggestion. It was something that was available to all nursing homes and their families. And then the National Guard testing is really important too, that they've offered that free immediate service. I think we requested it yesterday and they came today, or they'll be coming today or tomorrow. And they come in, they're professionals, and they assist with the testing of the entire staff and all of the residents. So again, it only shows you a snapshot in time, but it's very useful, as the mayor said, right in the peak of the outbreak, to have this kind of testing and isolate any potential cases that we don't know about is really important. So if I had to choose my one time to do it, this is the week I'd want to do it. So I'm really happy that one of our nursing homes at least has took that on today, and probably the other one will follow suit. And again, we may have a handful of cases to manage by the end of the week. We realize that the nurses are ready, but we would rather have that challenge and figure out how to isolate, how to quarantine people appropriately at this point before things go any further. So the managers have been great. They're in pretty constant contact with our nursing team and our chairman of the Board of Health as well. If they need things, they were looking for temporal thermometers for their staff. We were able to locate some of those for them. So as they need things, again, our inventory manager is ready to assist them with anything they need. And just talking through different situations as they come up. The return to work protocol is different for healthcare workers than it is for you and I. And that's in an attempt to more quickly. Yeah, yes. It's kind of an attempt to expedite the isolation period so that as soon as the person is symptom-free for so many days and fever-free and safe to return to work, they are quickly returned to work based on that, versus based on a series of negative testing, which can take a lot longer, as you know. So the state has developed protocols. They've changed several times. They're confusing to work with. So we spend a lot of time, our nursing team with the managers there and their nursing team to make sure that they understand and they're following those return to work protocols,
Just to be clear,
and assisting in any way.
this is in the nursing homes, the return to work
Yeah.
nursing home.
Yeah.
Okay, great.
It's true for any healthcare workers or first responders, EMS. Anyone who's considered an essential healthcare provider follows a different protocol than the rest of us. Yeah.
And I want to give a shout out.
Sefatia, we have about four or 5 minutes left to chat. Just want to
Okay. Well, I just want to give a shout out too, because she said it. We don't just work with Gloucester, we work with everyone. And urgent care in Beverly and Swampscott, I mean, they've been great. Kathy Numerosi, I want to finally say a name, has been amazing. That girl has been working like everyone else around the clock, but when we need things right away, it's been great. You know what? Some people need testing immediately, or some people need this, or we needed equipment, we needed things, and that's what's saying. And that's what we did before, is that now we made a new networking that's expanded out of this little island, out of Cape Ann, which is great, because it just shows that, you know what, we're all trying to do the best we can, and we all need to work together, and we all need to make sure that everyone has their PPEs. Everyone has to have that, and we share and we tell people. And at my fire department, it was John Sangers and then Phil Harvey. What they've done, I mean, one of the local restaurants, Ocean Garden, donated 2,000 masks. 2,000 masks. Brad at All Seasons. I can't even tell you these gears. I just want to wear one of those plastic suits just to protect. It's like a bubble. Can I give you this, May? Everyone that's making masks, I bought some masks today, and and one has a little from Jessica Churchill, has a little thing on it, says, we're in this together. She can put this, we're in this together. It's just been so amazing. And you know what, you have to understand that someone's going to pass, and it's very difficult for our nurses when you try to talk to the families, but already they're trying to set up something like a grieving counselor for some of these families. It's the most difficult thing in the world, is not to be able to say goodbye. That's so difficult, and my heart goes out to these families, because I know you all, and it is hard, and it's difficult. And some of them said, my mom, it's okay, she had a good life, but when it's someone young like Willie, we all know, it's difficult, and it's hard to understand. It's like you get angry, but we set up with some grieving counselors, just to the whole concept of what we could do. And so that like the nursing homes, everyone's hearing, well, she went back to work. Like she said, there's different protocols. When we physically met with people, the first ones we did call, we also let them on know too, because you know what, they're right behind us. So if they're all full, it wasn't just, let's think of Gloucester, let's think around, because you know what, hopefully when it does, people are gonna, I say cross-pollinate. We're gonna have Salem and Beverly and everything else, and the tourists and everything else. And I want us to go back to normal, but what is normal? Until we can figure out all of this, I just ask everyone, please, there's no vaccine right now. They're working on it. There's no, quick answer. It's, you gotta stay home. You have to just do the social distances, keep washing. You know what? I'm going to show you something. Today I wore my rings, and someone says, "Why are you wearing your rings?" I says, "Because they're fake and I like them." And they says, "Absolutely not, because when you wash your hands, it stays inside, so you're not really cleaning everything inside." Well, guess what? I'll let go, because the fact is, I don't want to give it to anyone either. And you know what? I carry it. I don't know. I may be immune to everything. I don't know. But the fact is, you know what? I want to respect you. And that's all I ask, is respect each other.
So, Sefatia, so I understand that the school superintendents throughout the state had a conference call today. Is there any idea on whether kids will actually be able to return to school before the end of this school year? Do you have any idea on that?
No, I really don't. Some people, some states already canceled those for the year. I don't really know. I haven't talked to Dr. Sapphire. We got the email and he put it together, what happened. And to be truthful, I haven't read it thoroughly. I've been on conference calls and we're figuring out what's going to happen. And before we got the recording, you saw what I had to deal with a little bit. I mean, people are telling me that I'm putting them out of business because I'm worried about the people, and people saying that if these people can't come in the city, then you might as well shut me down. I said, well, you know what? You're non-essential. I mean, the hotel's closed. I haven't gotten one complaint. All the restaurants haven't gotten a complaint. Everyone's complying. Everyone's trying. I'm sorry, but if your business depends on this week, as I said, give me 2 weeks. We need to close everything for 2 weeks. If your business is complying on those 2 weeks, then you know what? You didn't have a good business to begin with. I'm sorry. I'm going to insult them. They're going to watch it, but I don't care, because you know what? That hotel's been closed. That hotel is a lot. And it's a lot to Gloucester, because you don't realize all the hotel and motel taxes is what helps run a city. All the restaurants, the meal taxes, everything helps run a city. I have emails left and right of what is it when you lay off your employee about the GIC. We haven't laid off anyone. They're talking about already this year, and then they're saying they're not going to rehire them for 2021 because they don't have it in their budget. They don't know what's going to go on, because some of them are like us who run seasonally on a lot of things. And what's going to happen, because basically our season's almost over before it begins, because even if we open up, let's say we open up in June, or even whatever, we open up, by the time everyone fixes up their place, cleans it, whatever they need to do, you're talking about maybe the middle of end of June. Get people who had no jobs to think they're going to travel, or they're going to try to keep working steady or do anything they can to make up for what they lost. Okay. Even my philanthropists, people who are giving to the community to sponsor some of the programs we have in Gloucester to make Gloucester great in the summer. Well, I can't ask them, well, do you have an extra $25,000 so we can do, the block parties or the fireworks or anything else, because it's not run by the city? Am I going to be able to, who's going to do the fundraising? When you have people, either whether it's stock markets or their companies, or nobody's working right now. You can't, that's the most people. Our season, when I talk to some of the restaurants, they says, even if we start moving really fast, Maya, you do a great job, it comes and we start getting a lot of clients and a lot of people, and it starts people feeling comfortable about traveling, because people are afraid. So even if we get to open in June or July, you start seeing people turn over in August. Okay. So it happens in August, and then September's Labor Day gets cold, it starts going in October. There it goes. Season basically for a lot is closed. So we have to recoup everything you think we can recoup in 3 months, and that's hard. And that's very hard for some of these restaurants, because they're still paying for the back. Even if they say, well, you can furlough your mortgage, well, that's still going to pay at the end, or your interest, or anything else, or the SBA loans. You know what? Now it was everyone can get an SBA loan. You can do it this way. Now it's first come, first serve. The money's dwindling. Okay, now, you know what? Even though it's just very difficult. And you know what? 2 weeks, I'm not closing the city. I'm not saying that, I'm just asking for some guidance from the state on what I should do about boat launches. Now, I know some of the marinas are all calling, because I don't know how, because I was only talking to Lieutenant Governor, my harbor master, and Jim Justino came on after, how all of these marinas from Cape Cod, you heard the person say on the phone that Cape Cod's been calling, going, "What's your mayor doing?" I'm protecting my citizens. That's what I'm doing. I have 30,000 people plus on my shoulders, and I have to look at all the angles. Now, if you look at Monty Walsh, he's looking at all his buildings because they're so confined. And I used to say I'm so lucky because my neighbor is the ocean, but I still have to protect people for those people that come in and by ocean. Or people that want to just get out, or, other places are all closed. And my biggest there, if we were all opened, then we're all open. But every private place, every city that owns their own private landings or launches are closed. So what does that mean for Gloucester? I don't care what anyone says. They're not coming by boat. They have to launch their boat. So they're going to come by car. And they're going to leave their car on park, whatever they're going to do. I don't know how many they're going to have in a car, how you're going to watch it. The massive people, because tomorrow it opens, the massive people that are going to be there. Because as I was talking to Lieutenant Governor, TJ was watching people come in already. And you can't stop them because tomorrow's the day. And that's my fear is, do we do a protocol? I said to her, I said to Lieutenant Governor, is there a list that we need to say, well, where have you been for the past 2 weeks? Have you come from another state? Something that we could give them the harbor master and they can mail it back. Something so we know where, well, I know they have the boat registrations, but that, you know what, let me tell you, you have my car registration too. It doesn't mean you know how many people are in my car.
Right.
You know, it doesn't mean you don't know where I've been. You don't, that's what I'm saying. Someone, she said, or, he said to me in one of the marinas, were saying, well, I'll have their registration. Well, you don't know if you didn't ask any questions where they've been in the past 2 weeks. How do I know if they just came back from Florida, they came to their summer home here and then wherever? You know, we're supposed to be quarantined for 2 weeks. Did they do it? It's simple questions that I just want to make sure. And what's wrong with the mayor making sure? I talked to some other mayors on the coastal. You know, we have a lot from Cape Ann to Cape Cod. A lot of us are coastal. And it's kind of disappointing when you say to me, you know, you know what, Mayor, you're gonna ruin my business. Well, you know what? There's a lot of people who have their doors shut, and they have their shut because they right away, even before we said the state said it, they did it because you know what? They want to protect some people. You heard earlier about the nursing homes, are most vulnerable. You heard about a Gloucester Housing Authority. We have 6 senior complexes full. So we have 600 and something seniors living in those places. You know, I can't risk one more person. I can't tell that person, I'm going to open up because, and you can't say goodbye to someone that you love because we were careless. 2 weeks. I'm asking 2 weeks, people. It's just 2 weeks. And someone says, well, what happens if it goes on the next 2 weeks? Well, that means that you know what? The peak is still rising, isn't it? I don't close down the state. I didn't close down the city. And nobody closed down anything. It's an advisory for you to stay home. Yes, we made some extra little precautions of shutting down some more of our parking lots and some of the more walking areas where, you know what, we're parking, and when you get out of the car, it wasn't 6 feet. And we saw them sitting in front of their cars talking because you're excited. It's beautiful out. You're not in the house. You want to see people, not via Zoom. You know, you want to just actually interact. I understand that. Just like I would love to be on a boat right now, far away. Love to be on a boat. Just the ocean. Everyone wants to do what they love to do. But you know what? I wish that those 4 people that died didn't die because I love my seniors and I love my friends. I have to protect everyone. And in order for me to do that, I have to say yes to everyone, or no to everyone. That's how I started. Yes to everyone, or no to everyone. And yes is, we all follow the same rules. I can't break anyone's rules because someone's going to lose their business or someone is going to get angry at me, because I know after now there's already enough people angry at me and there's all these, but you know what? I'll tell you one thing. When I look in the mirror, my mother always says, if you can look in the mirror and you like what you look at, not the grays, but you like the conscience that's there, when you can go to sleep, then you're doing a good job. And you know what? I wouldn't be able to sleep if I known that I was letting this one do this or this one do that. I'm not saying no. I'm just saying I want some guidance from the state, the CDC, the Board of Health, and everything else. How can we make it safe for everyone? And don't forget, your boaters that you think that are going to be great, I'm not saying they're evil. If someone, you know what, you never know what's going to happen on that boat. Someone gets sick or whatever. I have to send out either the Coast Guard or the Harbor Master. And how do I know why you're sick or what's going on? And
Right.
I can't put the Coast Guard or my Harbor Master's office in jeopardy. Now, someone says, well, what's going to happen this summer? Well, we know if everyone's healthy, everyone's fine, everything's going on, that's tourist. But right now, we know there's a virus and it's a killer. It's invisible. We're fighting an invisible war, people. So I'm not sending people out to say, here, go. Because you know what? What did your healthcare people? What do you see every day in New York? What do you see every day in every commercial? What do you see? Please stay home. Help us save lives. What do you see when you see that a mother who's a nurse and her husband is a doctor? When they said, both of them I think were doctors, and they said, well, we made a smart choice. We have our children at my mom's house. We haven't seen them in 3 weeks. We see them every night during FaceTime. So you know what? What does that mean to you? It means that they're giving up their own wonderful life to protect ours. So for 2 weeks, I'm asking you people, be cautious what you're doing. Save your own life. Wear anything you want on your face. Face coverings. You don't need the N94s. Wear some gloves if you're going to do anything else. If not, keep washing, sanitize. You know, I know you all want to go fishing, so it's not for commercial boats. Commercial boats are out there already. Lobstermen can go out. clam diggers who have their boats can go out. Any commercial person that needs to go out is going out fishing. I'm just saying a little bit of pleasure, 2 weeks. And if the state says we're fine in 2 weeks, well then fine. If not, then we'll do what the state complies. I'm only asking that. I'm not adding things. We're not overreacting this time. We're not saying to people, you know, how do you think those people that we made stay in place at the shelter, at the YMCA, thank you to the YMCA. They've been there now for 30 days. They go outside for a little bit and inside. No choice, you know? But they're all, you know what? They're sending me smiles, and yes, then they're sending the, you know, these little cards they're making saying, thank you, we're safe. Come on, people. You're in your house. You're in your backyard. No one stops you from going to the grocery store. No one stopped you from taking a ride. How about others that can't get out? How about people who want to go into the nursing home and see their loved ones? Or the ones that used to be able to come out and they can't. Or now that we're saying now at the Gloucester Housing Authority, the little interaction that they had with people. You can't. We're looking for volunteers to do greeters, to at least, you know, stand at the door and how are you and whatever to the ones that are there. So you know what, people? 2 weeks, but you're not looking at your neighbor. You're not looking at, okay, I want my fun. I want to do because it's my constitutional rights. If I hear that one more time, it's my constitutional right to do what you want. But it's also everyone else's constitutional right to live. And you know what? We don't know who's going to die next. So if we all can prevent a little bit of it, and we all can say what we did our part, then you know what? If it happens, it happens. But if it happens because we're careless, because we didn't care, and I said, well, everyone, you know what? I need the hotel taxes. I need this. Let's everyone come in or whatever. I can't do that. I'd rather you not vote for me. I'd rather not be mayor next time. I really don't want to. If you think that I'm going to open this city to risk lives, then you know what? I'm sorry. I did my job, and then I can say goodbye, but I refuse to let carelessness in because you don't like me. Guess what? I like you, and I look in the mirror, and I know that I did a damn good job. I have a wonderful, wonderful team. And I get emotional because you know what? They hear all the terrible things, and they hear everything every day, and you know what? And they hear all this nastiness because people want to be selfish. And they're doing all the work that they can. And they, you know what, the nurses that came over the school side jumped right over without saying no. You know, the first responders, their families, their wives, their husbands, everyone is participating into making everyone's life safe. And if we can't do that as human beings, there's nothing. You know, the church is all closed. You know, we say you need your faith. Even that's going online. Even everyone else who don't even believe in anything but want hope and believe in something. You know, all the faith that we have in Gloucester, and I was one of the fortunate kids because I didn't know that inner city kids were inner city kids. I thought we were the best kids ever because I had, growing up, Trinity Church, the UU Church, St. John's, and the Temple all on one street. And I was Catholic. And the Y, and the library. I don't know about anyone else, but I thought I had the best neighborhood ever. So I was brought up with everyone's faith. And you know what? It was the best time of my life. And right now I'm feeling everyone's faith pulled together, whether you celebrated Easter or Passover or whatever you may have fasted, whether it's Buddha or Allah, it didn't even matter. Everyone in the United States with different faiths, even people with no faith, were saying, let's stand together. Let's be together. That's all you can ask for. Is, you know what, let's do this together. Because even though we think we're safe in Gloucester, well, how about our neighbors? Just open the TV and see what's happening in New York. See what's happening in Boston. See what's happening everywhere else. You know what, we should be thankful that we have. We should be thankful for what we do have. We'll be able to use that ocean. We'll be able to be going swimming. Today they asked me, are you going to post? They posted the jobs for the summer. You know, summer jobs, these little jobs. I said, I'm not sharing that. Last time I shared about the beach stickers, forget it. It was like, I had to delete it.
That was a good one.
Yeah, I'm not sharing that one. They're looking for summer jobs, and it's great. And I want to, and I told people, I love when people come to Gloucester. I love telling them about the history of fishing industry. And look at the industry that's pulled together, like, okay, Poor Michigan Mike, he thought he was doing a favor because no one wanted to buy lobsters. The poor guy, love him to death. You know, no one wanted them. These were his own personal lobsters that they counted for. It's not like they hid him or stole them from, you know, nowhere National Marine Fisheries. It was his shit. He says, I'll sell them and give whatever money to buy food for someone else. He got a fine for $700 and something dollars from the environmental police for doing good. Those, you know, it's just that, you know what, people don't understand what's happening. And you know what, and I know a lot of people are more better off, and I know a lot of people quarantined, and I would say to the person that I went shopping for, she says, you know what, we're fine, give it to someone else. I says, absolutely not. I says, you know what, there is no income scale here. You're home, you know, you're self-employed, you know, by the time you get everything you have to get, I says, you know what, Ruth Pino donated some cards. Let me go shopping for you. And I got help for going shopping. That's okay. I got followed with the company's card. That's okay. But the fact is, you know what? Just to do with that little, and you know what? I didn't buy the groceries. I only went shopping and I delivered them. But you know what? And I want to thank Ruth because I got all the feeling of goodness. See, someone says, why do you guys volunteer all the time? Or my sister's volunteering and everyone else. I think we're selfish because the feeling you get from doing something good to somebody else is the most wonderful feeling in the world. And if I'm selfish, then I'm selfish because that's a great feeling. It's not because I want to do ribbon cutting or I want your vote or whatever. I don't give a shit. I said it. Yes, I don't give a shit. I care about the person that I'm helping. And my family's done it since we were younger. We were taught by my father, Peter Anastas, some of the best, Tim Riley, Bill Rochford for action. We've been doing it since we lived. I didn't want to do it at 12, though. We had to do it at 12, but that's okay. But you learned and appreciated that, you know what? We're all in the same boat. And that's what's happening right now. We're all in the same boat. So I want to thank you. I think it's great that you're bringing news out to people. I think it's great that, you know what, I'm so glad that Karin, she's on another conference, that's how many we have, that you got to understand the process of what they're doing. And we've been doing that. Like the first week, there was little glitches here and there, and boy, did we cram down. And I mean, actually the first weekend, I'm going like, okay, she's not here, who's there, who's is that? I started calling people that I knew. You know, I had some friends who, you know, some people stopped the novenas, some people still continued or whatever. And then they started blaming the people who were praying, you brought it. No, they did not. You know, this disease didn't say, I want to pick you at this time because of that one. But it so happened that, you know, some people were praying together. And if it goes to one, that's what I'm saying. The husband passed, the wife's alive, another person's sick, the other one's not. It jumps. You're living in the same household. Your husband ends up in intensive care. You're home with nothing, yet you were at the same facilities, you were at the same people, you live together, you sleep in the same bed, but she's fine, thank God, I'm not complaining, and he died. So we don't know. That's what I'm saying. It's not something you know, oh, she took an extra antibiotic. Nope. Oh, no, we don't know, and that's what's scary. We had a whole house full of people who were all under quarantine, and one person just actually touched another person in that house and went home. She ended up getting it, just touching that person, just touching. And you know what? The mom died and they all went through the whole thing and they're all, thank God, they're all healthy, but they lost their mom, you know, and the same thing. And we saw, you know, William and his mom's home and poor Willie. You just don't know. It's not young, it's not old, it's not by touch, it's not living. We just don't know. Doesn't that scare you? Because it scares the daylights out of me.
Terrifying.
So why would I want more people here that I don't know? That are not gonna, if you really are so that anxious that you want to go out on your boat, then you're not even respecting staying home. I'm sorry. Because you're not even home if you're taking your boat out, are you? Right. So you know what? Thank you. I feel better now. This is great therapy, you know. Great therapy.
Love having
it. It's great therapy. It really is. It's great saying, you know what, sometimes you just want to say what you want to say. You know what, you're not going to like me. You're not going to vote for me. This isn't for votes. I could give a shit. This is for human rights. This is for human beings. I have to put people I look with every day first. It has nothing to do with politics, people. None of us. Do you really think the governor hears other, you know, we talk about it. You hear what other states are doing and what they're not doing. And we shut this all down or don't do that. You're an idiot or whatever, this and that. We see it all. We see it all. But you know what? He wants to see his father too. His father's 91. May not see him again. That's scary too. He gets emotional. Same thing with Lieutenant Governor. She has parents. You know, I was talking to Senator Tuck every day, and Margaret. And Margaret's been in quarantine since day one. She has 3 people that are high risk in her house, and she's caring for 3 people. She hasn't gone out, no matter what. You know how many? One time I was delivering some food, and it's like the distance. You know what? And you figured, oh, in the beginning, oh, it's certain. She threw gloves at me. She threw the mask at me, and this wasn't no mandate. No. She says, I can't. You know what? I already lost my mother so many times. It's a miracle she's alive. If it hits her, she's gone. There's no ifs and buts about it. Nothing. She hasn't gone anywhere. Anywhere. We talk to each other all the time. And how you doing for Easter? We talk, how you doing? The spirits? You know, we're doing good. We're thinking about you. You know, we're praying for you. And that's what it's all about. Can you imagine? I mean, she has 3 high risk people in her household.
Can you imagine? And
3 high risk.
Yeah. And
it's scary. So you know what? I mean, and you know, and it's small house. It's, you know, so that means 4 of them. And you know what? They all have their own conditions. So she's being caregiver for 4 people with 4 different conditions who are very serious. And that's hard. So 2 more weeks.
Yeah.
It is. It's incredible. First of all, it's remarkable that she's done it this long and everything else, but at least she got to go out. And now, I mean, you know what? Talk about insanity. I'm going, you okay? One day we group text, and I put the little smile, and I made her a funny face and everything else so we could laugh. And she says, wait, I want to, and then that's the whole thing. She goes, wait, you know what? I have a friend who's having a difficult time. I want her to join us. How do we join it? Because her grandson is not understanding why, let's say, someone just left out of his house or was going through a little trauma. That's how she is. Putting someone else first. Let's go do this person and do all those. And he was laughing, this little kid, the joy of this little kid laughing, because the mayor looked like, I don't know, Porky Pig or whatever the hell it was, one of those faces, a little squirt gun or whatever, and the hearts and the angels and the bunnies, and Margaret, I don't know, she looked like Elvis, had this whole thing on. We're all going at it. But the smile on the kid, but the smile on the grandmother was going through a very stressful time, was priceless. Was absolutely priceless. Learn something new. Let's play with our little emojis, you know, but a little thing like that, a little gesture like that goes a long way, people. I have to go because I have a conference call. I want to thank you all. I understand that it's difficult for you guys too. You're hearing everyone's different stories, and how do you bring it out there and what's going on? It is difficult, but you know what? I think you should have Karin again. It's really helpful so people understand what's going on and what we're doing in the community, and to be proud of our community. It's very strong community. So I want to thank you all. God bless you all, because I am Catholic. God bless you all. But I want you to be safe, stay home, go for a walk. Absolutely. Even if you don't believe and you all think we're crazy and it's going to happen, it was man-made, whatever, I don't care what you think. Be safe. I wish you well more because you don't believe. But everyone have a good day.
thank you.
Thanks, Sefatia. Bye.
Bye, honey.